to our experienced Mindray product. As we all know, ultrasound has been an imaging modality with multiple applications for the past decades. Functional methods such as elastography and contrast imaging has been clinically introduced. Yet, qualified imaging or contrast-enhanced scans for diagnosis is no longer the whole story when ultrasound comes to radiology doctors. Interventional radiology is most often guided by CT or MRI. Ultrasound also became a therapeutic tool in interventional as it provides real-time results that are permanently recordable in high resolution with no radiation. Mindray is always dedicated to the most innovative solution. We now offer Resona R9 for the one solution of diagnosis and increasing range of therapeutic procedures. A wide variety of advanced clinical features on Resona R9 not only enables us to provide quick and accurate exams, see clearly, and confidentially diagnose a broad range of conditions, but also to detect problems in the liver, heart, kidney, or abdomen with quantitative results. Besides that, Resona R9 also provides intelligence safe guidance of interventional radiology. Though functional methods for diagnosis such as elastography and contrast imaging have been clinically introduced, there are still a couple of challenges that ultrasound systems have to face. We are one of the most comprehensive share-wave elastography providers in the industry. Based on the ZST Plus platform, the real-time capability of sound touch elastography is significantly improved. That not only ensures better performance for clinical elastography scanning, but also enables more efficient real-time 2D share-wave elastography exams. Additionally, the quantitative report gives more information to help with the diagnosis while minimizes the subjectivity. Besides the use of typical application of ABD, thyroid, breast, etc., Resona R9 also supports prostate and gynecology share-wave elastography with high, sensitive, and specific elastography. Our high frame rate contrast is a new faster contrast technology that breaks the limitation of frame rate in routine contrast, reaching up to 4 to 17 times higher than the traditional frame rate. With high frame rate contrast, not only the tumor of hepatocellular carcinoma quickly washed in, details could be visualized, but the enhancement of lesion surrounding supply vessels also can be observed. We have a higher temporal resolution to capture the perfusion details in the arterial phase from benign to malignant, and higher spatial resolution clearly delineates the structure of tumor and surrounding supply vessels. Combined with ultra-wideband non-linear contrast, Mindray provides full-face evaluation in the perfusion process for both diagnostic and interventional clinical practice. Besides all qualified and quantitative tools to assist diagnosis, the advanced features on Resona R9 also provide intelligent yet safe guidance for therapeutic interventional procedures. Here we dropped a whole solution for bringing ultrasound-guided intervention to another level. iFusion is the fusion imaging to take advantage of different modalities for more precise treatment. We also have UHIT, ultrasound-guided hepatic interventional therapy, to provide advanced fusion-based 3D ablation tool for the liver percutaneous ablation procedure. Compared to traditional multimodality fusion imaging, the registration accuracy of ultrasound to ultrasound-based fusion imaging is relatively high, and it's easier to use and makes more consistent interventional therapy. UHIT Navy is an ablation system to realize 3D ablation planning and guidance. It brings more confidence in ablation for the sake of less experience dependency. After 3D planning and guidance, we have UHIT ablation to provide you instant 3D evaluation and avoid the risk of recurrence. This is the one solution for diagnostic and therapeutic procedures on Resona R9. It not only offers features to make ultrasound tumor diagnosis more accurately and efficiently, but also show great promise of intelligence guidance in interventional radiology. Thank you for watching.
Once you find a lesion, press freeze and tap Smart Breast on the touchscreen. Rotate the knob under side to select left or right according to the position of the target. Mass 1 is displayed as default. Select Mass 1, move the trackball or drag it to confirm the position of the breast lesion. Rotate the angle button or sweep a finger on the touchscreen anti-clockwise or clockwise around the probe marker to adjust the orientation. Choose the corresponding view. Select Sagittal View. Press the Update button on the control panel or tap Here to start detection. The system will automatically identify and delineate the contours of the mass. Press Set to complete the measurement of the nodule. Press Save to confirm the detected mass. Then the picture on the corresponding view will be changed to the detected image on the touchscreen. Repeat these steps to perform mass detection and measurements for other views. You are able to recall the saved images to analyze using Smart Breast. Choose the short axis view on the touchscreen, then adjust the probe marker. Press Update on the control panel to start detection. The system will automatically identify the mass. If you want to edit the mass contour, move the cursor to the position to be modified by using the trackball and press Set to determine the starting point of editing. Then move the trackball to draw the line and press Set to confirm the endpoint and complete the editing. Press Set again to complete the measurement of the mass. Press Save to confirm the detected mass. Go to the next view. Choose the malignant signs view on the touchscreen if necessary. Press the Update button on the control panel to start detection. If 2 or more lesions are detected, press Update to select the desired lesion, which is then surrounded by a green rectangle, and press Set to confirm the selected lesion. Measurements can be edited if necessary. Press Set to complete the measurement of the mass. Press Save to confirm the detected mass. For malignant signs views, you can tap plus to add more new malignant sign views if necessary. You can also delete views by long pressing on the plus view, then tap minus to delete. You can also add a view with color. Choose the vascularity view on the touchscreen. Press the Update button on the control panel, or tap Here to start detection. The system detects the vascularity on the mass area. Press Save to confirm the result. After all the steps for detected views, choose Analyze Mass on the touchscreen to enter the BI-RAD classification. The system will make a comprehensive analysis on detected views, show the BI-RAD's features automatically, shape, orientation, margin, echo pattern, and posterior features of the mass, and so on. The specific description of the corresponding features is displayed on the touchscreen and monitor. This can be modified as needed. Edit the analysis results if necessary. Finally, select the BI-RADS level, then tap Confirm to save the analysis results. Go to the report to see all the results, standardized measurements, overview diagram, BI-RADS feature descriptions, and assessment category.
In order to get a good 3D or 4D image, first we must have a good 2D image. So let's begin. First, press the power button on the control panel to turn the system on. Then press the probe key to select the volume probe on the touchscreen. Choose the second or third OB trimester exam mode. Before scanning, please orient the probe mark on the transducer and ensure to manipulate the probe correctly. Static 3D means one single volume 3D image. 4D means to acquire real-time 3D images. The difference is that in static 3D mode, only a single set of 3D volumetric data is captured, while in 4D mode, multiple sets of 3D volumetric data within a continuous time frame is acquired and aligned chronologically. The best plane to get a good 3D or 4D image is the mid-sagittal plane. So you need to find the sagittal plane like this. First, you should obtain the BPD imaging plane. After obtaining the BPD imaging plane, rotate the transducer like this to obtain the sagittal plane. If you are not in the standard mid-sagittal plane, just adjust the probe position slowly to get the mid-sagittal plane. When you get the mid-sagittal plane, the 2D image preparation work is ready. Press the 3D key on the control panel, then the ROI box will show up. Use the set key and trackball to adjust the size of the region of interest and move it to the appropriate position. The size of the region of interest should be appropriate. Not too small, not too large. Move the region of interest to contain the whole fetal head without any blockage. Improper volume can't get good and complete 3D image. Use the set key to activate the volume curve and adjust it with the trackball moving as close to the fetal face surface as possible. Press Update key on the control panel to start the 3D image acquisition. The acquisition process is being done automatically. During the period, please maintain the probe in the still position. Press the 4D key on the control panel, then the region of interest box will show up. Use the set key and trackball to adjust the size of the region of interest and move it to the appropriate position. Press Update key on the control panel to enter the 4D image real-time display status. Press the Freeze key on the control panel to freeze the image. Then the 4D image acquisition will automatically be terminated. After obtaining the 3D or 4D image, you can perform post-processing and editing of the image to allow for image improvement. Rotate this knob to select the right threshold setting according to the 3D or 4D image performance. Remember that a too high threshold setting causes the loss of details, while a too low threshold setting produces too much noise. iLive is a revolutionary way to obtain virtual, realistic views of the fetus surface with natural human skin color. Press the iLive key on the touchscreen to enter the iLive mode. Change the light position by using the trackball to move the light to obtain different effects. Press the single key to enter the single window and display a single 3D or 4D image only in full screen. Press the dual key to enter the dual mode and display a 2D and 3D or 4D image side by side. Press the quad key to enter the quad mode, which displays 3 2D images in 3 directions plus a 3D or 4D image. This is a default factory setting. In 3D imaging mode, press the Save key on the control panel to save the current image to the Patient Information Management System. In 4D imaging mode, press the user-defined Save key, Save Clip, to the Patient Information Management System.